I am now honoured to introduce Stella Kyriakides. As European Commissioner for Health and Food Safety since December 2019, she leads the Commission's work on various portfolios, including Europe's Beating Cancer Plan, and she is in charge of developing a new pharmaceutical strategy to ensure Europe can meet the needs related to affordable medicines. During the past year, she has coordinated the EU's response and supported member states in confronting the pandemic. It is truly an honour for me to introduce her and to welcome her to our conference today.
Good morning, everyone, dear colleagues, ladies and gentlemen. It is a pleasure to join you here today in this very important event, and I want to express my thanks to The Economist for your title of your event. Really says it all. I think it speaks about needing a breath of fresh air, and I'd like to start from this need to have a breath of fresh air, which I believe the cancer plan will bring by promoting pan-European collaboration and cooperation in all the areas related to cancer, with a holistic approach for the benefit of all Europeans. Ladies and gentlemen, in Greece, 3/4 of all the diagnoses and the number of deaths are due to lung cancer, and they, of course, are related to the male population. However, lung cancer remains the second cause of death also for women after breast cancer. Lung cancer represents 12% of all the new cases of cancer, and in a total of the deaths of cancer in the European Union, we have an increase of over 20% in the last decade. These are very sad facts, facts that I would like not to have to repeat and to share with you, but I will never tire of repeating that these numbers are statistics. They represent people, and every person has his or her own life story. So we have facts and trends which are extremely worrying. Even more so in the present stage, as you mentioned, in the pandemic 19, we have faced even bigger challenges in the area of cancer care. So we are determined and we are focused to really extend all our efforts in order to face and to be able to see areas of cancer, including lung cancer. And for this, in order to be able to move forward, we have presented Europe's cancer plan, which was adopted by the Commission on the 3rd of February. This is I would say, a person-centric, a people-centric plan. It has many flagship initiatives, and it has four basic pillars on which it is based. I would also like to share with you that to put this plan together within a team horizontally in the European Union, and this, I think, shows how holistically we are seeing the area of cancer and Europe's Beating Cancer Plan. So the first axis is an area where we could deal more, and that is prevention. We will be looking at the major risk factors. Smoking, of course, is one. Being exposed to carcinogenic substances, to radioactivity. Factors, though, all lead to rates of lung cancer. In parallel, we will be looking at updating the European Cancer, which will have clear recommendations on the way that we can all limit the death of this disease for both ourselves and for our family. Our aim is by 2040 to have a generation without being on smoking. Less than 5% of the population will be using smoking-related products. And this is in comparison to 40%, which it is about today in Greece. It is very important that we move forward with these targets, which can to preventing 9 to 10 of cases of lung cancer. So the axis of prevention is undoubtedly especially important for all member states and of course for Greece. In your country today, there are many targeted initiatives in order to raise awareness between different age groups, which target prevention. And you're also looking at and taking significant measures in order to limit access to tobacco products. But we must all work hard and much harder to achieve this target of 5% use of tobacco. We know that this is something that we all have to work together with at the level of the European Union. It can lead to significant importance that will benefit each and every one of us. I would like also here to stress that, for example, in the plan that we have for the control of the use of tobacco products. This is also being coordinated by the Greek Anti-Cancer Society. The member states are joining their forces in order to support the directive of the European Union concerning tobacco products. So this is an especially, I would say, successful action, which shows the many important steps that we can take when we work together in solidarity. The second pillar of Europe's Beating Cancer Plan is early diagnosis. We will be moving to having a new program of early diagnosis, which will be including cervical cancer, breast cancer, colorectal cancer, and which will aim to cover 90% of Europe's population by 2025. We'll be working with all the member states in order to achieve a new guidelines of the European Council so that early diagnosis can also be extended to lung cancer. And we'll be using digital solutions and technology in order to have better information concerning prevention so that more European citizens take part in prevention programs and in early diagnosis and screening programs. The importance of screening cannot be underestimated, and we do not extend screening, but we want to ensure that the screening programs that are taking place follow optimal guidelines in order to ensure that we are really giving European citizens what is really best practice in terms of screening. The pillar of the European Beating Plan concerns diagnosis and treatment. And it will have several flagship initiatives. I will mention only two. First of all, the importance of having comprehensive cancers in order to have the best optimal care throughout the European Union. This is not about building new centers, but about connecting the centers with best practice so that there is exchange of best practice, and it is the best practice that travels and not the patient themselves. And secondly, an innovative approach for the diagnosis and treatment of cancer for all, which will give better access to new innovative treatments and diagnosis equally for all patients of the European Union. We will be creating an inequality there, looking at inequalities, and the reason and the thinking behind this is not in order to in a sense point finger at any member states to highlight inequalities, but there are weaknesses so we can support. This is about working together. This is about supporting, finding the gap. And finally, the last pillar is the very significant of a better life for cancer patients. We'll be creating what we have called card. Those who have been through a cancer experience, there will be a digital European Digital Center for exchange of information of cancer patients, so that they can exchange for their care, so that the patient who has been through is able to have access to their own data, and this data can travel. It is very important for us that we also see inequalities for those who have survived cancer, patients and people who have been through cancer, who have fought a very hard battle in order to be able to deal with their disease, should not be facing any inequalities or discrimination in their life after this experience. We have been working with many commissioners in order to ensure that we fight any sort of discrimination faced by those who have had cancer in any area in their work and in any other area. Dear friends, colleagues, through the European Speed Plan, we aim to cover a very broad area, as you see, from prevention to treatment, from early diagnosis, screening, to care, to optimal care, and to quality of life. We had spoken about the pillars to do with prevention, which is especially, of course, relevant to lung cancer. The pillar to do with screening and the need to have optimal care, optimal screening, and our ambition and target to have 90% of all European citizens have access to optimal screening centres. Diagnosis and treatment, the need for comprehensive cancer centres with an innovative cancer diagnostic treatment for all initiative in order to have the best possible access to new diagnostics and treatments. For ourselves, we need to tackle inequalities in all forms of cancer, including lung cancer. And the Cancer Inequalities Register will take an evidence-based look at how investment and intervention at the EU can close the gaps. It's not about pointing the fingers, as I had said before, to where gaps are greater, but about lending a hand to where the needs are, so that no one is left behind. And in the fourth pillar, the Better Life for Cancer Patients initiative, including, among others, Cancer Survivor Smart Card and the Virtual European Cancer Patient Digital Center to exchange patient data for survivors and health conditions. And here our focus is on quality of life, because we believe that anyone that has been through cancer, and all cancer survivors need to have access to all the services that they should, without any sort of discrimination, and having to fight for their basic rights. I've gone again.